This summer, the FDA approved a brand new weight loss drug that's got everyone talking. But is this new weekly injection a true game changer? Let's take a look. Obesity has been linked to over 350,000 deaths a year, and more than 70% of Americans are considered overweight, and what's even more shocking, 1 out of 3 people are considered obese. But is there finally a cure to the battle of the bulge? The FDA recently approved a chronic weight management drug for the first time since 2014. The medication is injected under the skin, which mimics a hormone that targets area of the brain to regulate appetite and food intake to feel full faster. According to the FDA, it seems to work. Over a 68-week clinical trial, 33% of patients lost more than 20% of their body weight. But this treatment isn't just for everyone. The FDA recommends it for obese patients, and it needs to be used in conjunction with a reduced calorie diet and increased physical activity. So, is this just another fat-finding fad, or is this new drug finally the answer to lose weight once and for all? Joining us now via Zoom to help break down all the ins and outs is board-certified gastroenterologist, our friend and colleague, Dr. Sue Satcher. Welcome back to the show.
Thank you so much for having me. I must receive about 100 DMs a day regarding this new medication, and I think it is going to be a game changer.
Well, let's get right into it. Tell us more. So Doc, how exactly does it work, and how often should someone take it?
So it's considered a GLP-1 agonist. And what that does is it mimics a hormone our own bodies produce when we eat. And it tells us that we're full and to stop eating. But the problem is the one we make in our own body only lasts a couple of seconds, whereas this injection medication will last a whole week. So the FDA has approved it for anybody who is obese. And that means if your body mass index, which is a function of your height and your weight, is over 30, you're definitely a candidate. Now, there's still a lot of people who are in that overweight section. And if your body mass index is 27, which is considered overweight, but have high blood pressure, diabetes, high cholesterol, fatty liver, those people are a candidate too. And this is really going to be a game changer because it's the first medication that has been approved for long-term treatment. The trial was for 68 weeks, but it's the first weight loss medication that has been approved basically for the rest of your life. But I like to tell patients there's no magic pill, there's no magic injection. So if they're not motivated, nothing is going to help them.
So true when it comes to obesity and weight loss, that yes, maybe there's a pill, there's something that helps, but it's still basically good old-fashioned diet and exercise are the keys. What about the side effects, any risks that people should be aware of?
So every medication has side effects and nothing is, 100% perfect. But nausea definitely and GI problems are the most common side effects associated with it. And, we got our fingers crossed. Obesity is the #1 health problem, not just nationwide, but worldwide.
So you actually are using it in your practice. You have patients that are using it so far. What is your response, your feeling about it?
So the response has been good.
Another question I have for you as the expert, why has it been 7 years since the FDA has approved a new weight loss drug after we just agreed that it's such a huge problem, we need more help there?
Well, I think that a lot of these stimulant type medications have caused side effects that they've had to stop, and the trials can be continued. So hopefully this will be a safe class that we can go moving forward.